Yes, we can.
Awesome. All righty. So, well, hello everyone. My name is Deanna Rumbo. I am a certified nurse midwife and women's health nurse practitioner. And today, I kind of wanted to go over interviewing for midwifery positions. A lot of the information that I'm going to provide today hopefully is transferable to other aspects when it comes to interviewing, not just for midwifery positions, but for fellowships, for other moments when we are connecting with individuals and are trying to kind of learn more about a new role. And so I hope that we're individuals are able to get a lot of information from this. And I've at the very end, I did put a couple of resources that I recommend, and I'll also go over other resources that to find more information if we want to go into more detail about interviewing. So without further ado, we'll move on to the next piece. So part of the objectives I put for here, the first one is just to understand the value of an interview. The second one is understanding the process of how to interview for midwifery positions, knowing that this is a dynamic process that can change over time. I also have lists of questions an individual can ask during an interview, as well as some sample questions that individuals might be questioned when they are going through an interview. And then at the very end, listing resources to help with the preparation process. So I have this little piece right here. So first you've applied for a job, then you get a follow-up email or phone call, and then we start to think like, okay, what's the next step? And so it can be a first piece I like to say is congratulations on having someone follow up on that application. I know it can sometimes feel very difficult to send off a lot of applications and then not hear anything back. So congratulations on getting a follow up. Um, I wanted to kind of go over the importance of the interview. A lot of the times we think that during the interview is really for the employer to see if you are the person that is the right fit for their role, but it actually is a two-way street. The interview is really an important piece, not only for the applicant to see if the to learn about the role and as well as the expectations for that job position, but and it's also for the employer to see if do you have the skills that are necessary in order to fulfill the job that they have. And so a lot of the times it's not just about like, hey, how to impress someone in order to get the job, but also how to get the information that you need in order to understand, is this job going to be something that is gonna do you have the skills for the job? Do you have the are you also going to have the resources in order to be able to fulfill this job? And also just learning about the culture. What are going to be the expectations for this job? What are the what is going to be the support that is going to be provided? What are the things that you feel that are going to be beneficial for you? And are those things available at that job position? There are so many different setups for midwifery positions versus like some are in the hospital, some are full scope, meaning you have clinic and hospital. Others are private, others are freestanding birth center. So also learning like what's during the interview process, you kind of can have a better idea as to like what kind of clients are you going to see, what is your job schedule going to be like, and things of that nature. One big piece is that not having a clear understanding of what the job entails is going to be a really significant reason why people feel unsatisfied with their job, why there's high employee turnover, and why there is provider burnout. And so a big piece is like you also want to not only is do you have the skills to perform this job, but is this job also going to be one that's going to be supportive in what you are looking for? The other thing is that employees, recruiting is just expensive in general, not only just for the person who's applying to different jobs and having to travel for interviews and putting in expense for those things, but also hiring managers, it is expensive on their end to have to consistently be recruiting people over and over. If like you have someone that fills a position, stays there for 6 months, leaves, then they have to redo this process over and over and over again. So during the interview process, it's really important to get clear information on both sides as to is this the right fit. So the goal is to fit to be able to hire an individual that is the right fit for what the company is looking for, and then the individual feel that that work opportunity provides them fulfillment as well. So the other big piece I really wanted to highlight is there is a lot of turnover in midwifery. Just having to like say that out loud and be upfront that we are in a space right now where a lot of individuals are actually, unfortunately, leaving clinical practice. And so the ACNM workforce put out a brief in December. And based on these numbers, within so what the brief was kind of summarizing was how many people are renewing their CNM license after 5 years, after 10 years, because the CNM license is every 5 years. And unfortunately, at 5 years, we're having, if you see from right here, at 5 years, we have people still in practice around 69%. Then at 10 years, it drops to 54%. At 15 years, drops to 55. So the more time in practice, or the more years that someone has as a midwife, the less there's some individuals that are stepping back from their midwifery responsibilities. And it could be that they're still working in other aspects. So they might have are now in director roles or in other jobs. But those who are in clinical practice, we are starting to see big significant differences or big decreases in how long people are staying in midwifery. And I think there could be so many factors. We really want to fight for to have more one big piece is that we want more midwifery integration in teams. We also want healthcare systems to acknowledge and reimburse midwives for their work. And we also do want to just be still not be as invisible as in certain places. There are very low rates of OB providers, of family physicians, of primary care and midwifery. So we are seeing a lot of individuals over the past couple of years, especially after COVID, leaving clinical practice. And so one big thing is like, now as individuals are graduating from their programs and entering the workforce, how do we make sure that individuals are for their first job supported, and so that they supported to the point that now they stay at that job and also and stay in their respective fields for long term. And so that's why I think it's the interview process is such an important aspect. Because I know as a student, I was like, well, I just need to get the job that pays me well, and I'm in a good spot, like I just need the job. And then after a couple of experiences, recognizing like, okay, well, you want to make sure that you're at a place that you are also very supported so that you can stay in midwifery, because midwifery is a work of art, and it also takes a lot out of you as well as how much you are giving. So really making sure that individuals are in places that will allow them to reach their full potential, not only so that it can benefit just midwifery in general and the individuals that we take care of, but also so that we can increase the workforce and retain midwives. So that was one big piece I wanted to kind of go over on that slide. So for the interview process, this has changed, and I will say there's a caveat with it, because again, the interview process can change over time frame. But from what I've been seeing is that it used to be that you apply to a job on a company website, then you wait for maybe an interview or a phone call for an interview or an email saying like, hey, we'd like to proceed with your application into the next steps. We're starting to see more and more that individuals, how to apply to a job is that you're sending your resume to a recruiter. They're giving you a call back to go over the minimum, and you're connected with a recruiter who's going to go over like the minimum job requirements, and they're going to give you just like a broad overview of like, this is what's expected for this role. Sometimes they will go over like salary, like what the salary might be. And at that point in time, you can kind of also ask them like, oh, well, are there relocation bonuses? Is there negotiation when it comes to this salary base? Is there, are these numbers firm? And so you also kind of have an expectation as to like, if you do get an offer later down in the process, like what to expect, which I think this has changed from before, where individuals went through the whole process of interviewing, and it wasn't until the very end, whether they're giving you an offer, that they talk about salary, benefits, and things of that nature. And some individuals are like, well, if I had known what the salary was in the beginning, I might not have applied to this position. Or if I had known that I wasn't going to have certain benefits, I might not have applied to this position. So I'm starting to see more and more that individuals are posting it on their application, like what are the salaries, as well as benefits, but they're also connecting individuals with a recruiter who is kind of going to go over a little bit also the process of what to expect when applying for a midwifery job. A lot of the times, if you are applying to a big healthcare system, there are multiple phases when it comes to interviewing. Whereas if you apply to a private practice or a place where it's like one or two providers, they might not have an HR department. So you might just be directly speaking with whoever the director is there for, who's seeking for a new midwife. And like I said, during that time frame, if they do talk about like salary, that's where you can start asking a couple of questions as like, is it negotiable? Is this salary negotiable? Are there bonuses? Are there relocation assistance? Is there tuition assistance? So does this position qualify me for certain programs where I can get some of my loans paid for based on how many years I am at this position. Then following that screening process with a recruiter, again, this most of the time happens with bigger facilities. And then the second piece is usually an interview with the team leader, and the team leader could be like the director of midwifery. It could be the medical chief. It could be one of the like one of the people who oversees most of the like clinical providers. And during this process, this is where you are going to get more information as to like what are your specific clinic duties going to be. Like how many days are you going to be working in clinic? How long is clinic? How many patients are you going to be expected to see? If it's is this a hybrid position, meaning do you work in clinic and work in the hospital? So the team leader kind of can give you more information about the expectations in regards to the roles as a clinician. A lot of times this is where you can ask them more questions as to like, what do they envision? What are they looking for in a provider? And also a little bit of you can also have more information as to like, why are they filling this role? Are they filling this role because they're expanding? Are they filling this role? Is this a brand new role? Are they filling this role because 3 other people have quit? And so, you could also get a little bit of information on that piece. Like I said, a lot of the times this interview with like a team leader goes over just the expectations for what they do you meet like 1, minimum qualifications, and 2, do they after that piece is this a good fit as well? A lot of the times either the interview with the team leader and a group it might be that you do stepwise. So all of this could be like Step one, you get one phone call from a recruiter. Step two, you get connected to the like team leader. And if you pass that, then there's a group panel, or sometimes it's a screening with a recruiter, and then the second the team leader and group panel are together. So it could be different ways that this can be done, but I'm just giving you like one way that that can be done. A group, it's pretty common practice that there is a group panel where there's more than one provider in the interview process. Again, a majority of the time, one of them will be like the director, either if it's a midwifery director, an MD director, someone who is going to oversee all the clinicians. And during this group panel is where you'll kind of meet your team members. And so it's a lot of the time, not only are this is where they might ask you scenario questions, ask you about your experience, ask you about why are you interested in this role, what can you bring to the table, and this is where you can also ask them, well, how many providers are there, how much support is there within the providers, like has there been growth in this position? How long have the other providers been in this position? Has everyone just been brand new within the last year, or have people been there for 10, 15 years? That can give you can be a big highlight to like culture wise. Like, is it a revolving door of clinicians, or is it a place where people really want to connect with their coworkers? And then the last piece of an interview can be an interview with a chief medical director. This generally tends to happen for individuals who are applying, who are going to have hospital privileges. There's usually a short interview that you do with a chief medical officer to be cleared to get hospital privileges. So that last piece may not be applicable for individuals who are only applying for clinic positions, or who are applying at freestanding birth centers or small private practices. And then again, kind of like I had mentioned, the interview is not just for the employer, it's also for the person who is applying. And so what are some questions that you can ask? For new graduates, it's a really good time to see to ask what kind of benefits are going to be available for someone who is a new learner. So have new graduates been hired before? What is the orientation process going to be like? Is it going to be 2 weeks, 2 months? Are they going to start you off with a few patients and then slowly increase the amount of patients that you see? Are there additional support services and trainings? Are they going to train you to do ultrasounds? Are they going to pay for you to do additional trainings for specific procedures? What procedures do they anticipate that you are already what procedures do they feel like, hey, you should really know how to do this, we're not going to train you on this piece? So sometimes this can be like in regards to ultrasounds, in regards to if they do specific gynecology procedures like biopsies or things of that nature. Also, so those are some questions that you can ask to kind of get that information and see if you're going to get real good support when it comes to that job position. Because the biggest piece is, as a new graduate, you also want to have extra support in your first job, so that you I know it's a really delicate time where we feel that we cannot we're like, oh, and we have responsibility now, and so sometimes it can be really daunting. And so even asking like, am I going to be the only clinician in the clinic? Is there someone going to be with me for an extended period of time? So all those are really good questions to ask. And then asking a little bit more personal questions. These are the things that you would ask around when you have connecting with the team leader or with a group panel. Some additional questions could be like, are there job requirements outside of your scheduled hours? So a lot of the times they might say, oh, well, you work 2 clinic shifts and you work in the hospital from this many hospital shifts. But is there monthly meetings that you have to attend? Are there other job requirements that are done outside of your scheduled hours? Do you have time out of your schedule that is blocked for administrative purposes. So to follow up on people's lab results, to follow up on patient messages, to review medical records. Do you have like additional time that is yours, or is this all these extra things happening on unpaid time? The other piece is, why are they filling this role? You know, is it because that their practice is growing and they've valued midwifery and are like, we started with one midwife, then we went to two, then we went to three. Is this a new position? Like, oh, we've never had a midwife before, you're going to be the first one. How long have providers been working there? Again, it's information to see like how that can give you information as to like, one, how long has the practice been established, and the other piece is, are the providers supportive of each other to the point that they are staying there for long periods of time? And then what, even asking them like, what do they like about their job? And different answers can kind of clue you in. Like if they're saying like, well, I feel like I'm really supported, I really love my patients, I really love the way that I get to do certain procedures, or I love the autonomy to do X, Y, Z. These are all aspects to kind of clue you in as to what are the things that you can also be looking forward to when it comes to being part of this team. And the other one is, who handles concerns. All jobs have, we all are going to have moments where we have questions, we have concerns or conflicts. Who handles those whose concerns? And so is there a hierarchy? Is there a step level as to like, oh, this is the first person that you will report to if you have a question or concern, and then this would be the next person? And also kind of seeing how some individuals might give you, you can even ask like, hey, can you yourself can ask, hey, if I have a concern, or could you guys give me an example of when you had a concern, how was it dealt with? Because that can also give you a clue as to how are things delegated, how willing is the job environment willing to change if there is a concern, and how so you can get a little bit of information about safety culture within that by asking questions such as those. And then the other piece of like preparing for the interview, this is one that as someone who was applying for midwifery school in general, I was able to I looked for guidance as to like how to prepare for an interview. One of the big things that one of my mentors had talked to me was practice your elevator speech, or like your selling pitch. Because a lot of the time, some of the questions they're going to ask you is like, tell me a little bit about yourself, you know? And so, you know, a lot of people are like, it's an icebreaker, like, tell me a little bit about yourself. And a lot of the times you want to be able to show who you are, what you stand for. And a lot of the times it is really uncomfortable for us to talk about ourselves. It's just, we don't know why, but it just is a thing that we don't like to talk about ourselves. We don't like to brag about ourselves. We don't like to discuss all the great things that we do. So have like practice that piece, like practice a little like speech of like, you know, hey, my name is Diana. I'm a midwife who loves to be able to provide continuity care to my clients. I've worked in the past 3 years for in full scope practice, and I really want to continue to be able to take care of individuals from the time they are looking to become from a menarche all the way to menopause, and that has been something that I've been passionate about. Again, there's different little things that you can talk about, and just again practicing talking about yourself. Like again, it's something that all of us really struggle with. The other piece is researching that organization. A lot of times the questions they're going to ask you is like, why did you apply to this job? What is and so the organization itself is trying to see, are you applying because you just need to to take a position, or do you really want to be part of our practice because there are certain things that you value that we do? And a lot of practices a lot of practices again want to hire individuals who want to stay with their organization. A lot of practices do not want to be like hiring individuals that they have to keep rehiring over and over again. Again, it's an expensive process. It is a very grueling process to get someone through all the credentialing and all of the orientation, only to have that individual leave 6 months later and then have to do this again. So a lot of the times, these positions really want to know why you are applying to their position. A lot of times you can find information on their website. You can see the providers. Like sometimes providers are listed on like, these are our OB providers, these are our family medicine providers, these are our midwifery providers. And you can kind of see from there, a lot of them will have little bios. You can kind of even have information as to like, how many people are working there, how long have people been working there, and then and so that's one big piece. Like you do also want to know more about the position, as well as like what the company stands for, when because you can also like ask clarifying questions during your interview. And the last piece on preparing for an interview, it is really hard to talk to people again, especially when they're asking you questions. Sometimes they might ask you personal questions or questions that people don't always ask us. And so it's real different. If you're in school right now, one big piece is to use the resources that your school has. And one good resource that I felt has been really helpful for me is doing a practice interview, like a mock interview, where I sit down with someone and they ask me questions, and then I questions that either about myself or clinical questions, and I will go through and have that discussion with somebody. And that way, sometimes they just can get rid of the nerves that we sometimes have pent up, and it can just and you can also learn different little tidbits about yourself. One trick that one of my mentors had said was, you do not look at me in the face. You always look down, or you always look away, and it just feels like you're really like, it kind of feels shady. She told me. So she was like, I really would like for you to look at me in the face. And I was like, I can't look at people in the face, like especially in their eyes, because I was taught you don't look at someone in the eyes. Like that was just culturally not something that I'm used to. And so she told me, well, then you can look at my ear, or you can look at the side of my, like at the top of my head. That way you're not directly, it looks like you're directly looking at me, but you're not physically like staring me in the eyes. But sometimes having these little mock interviews with either like family, friends, or even just yourself recording yourself, you can kind of start learning little tidbits about things that you do that you might not notice. And so it's good to have that kind of like practice run of doing that, so that again, I didn't know that for me, it wasn't a big, I didn't know that I looked shady by looking away from people and not looking at them in the face. But that was something that I learned after doing a mock interview with her. And it was a mock interview for midwifery school that had nothing to do with my position. So just a piece of advice on that one. So here are some common interview questions. And the slides are going to be available for individuals to also look at afterwards with the recording of this presentation. But some of them, like I had mentioned, why here? Like, why do you want to work at this facility? Why do you think you would be a good fit? Why are you interested in this position? Would you be willing to relocate? Because sometimes if you're applying for a position at another state, or even within California, Northern, Central, and Southern California, the environment can make a big difference too. Of like, if you're going to relocate for a position, do you like, is there, some people might say like, I have family in that area, or that's an area that I know of, or if you don't, then kind of also would they be willing to fly you for an interview so you kind of have an idea of what the area looks like, and physically how that practice is going to be set up. Some examples of personal questions: 3 words to describe yourself. They always, I feel, will ask you some clinical situations, and it's more of, it doesn't have to be that you have to know the right answer. They just, a lot of the times it's kind of like, what is your thought process? And a lot of the times, so one big piece is they're just kind of wanting to understand your thought process. So always don't feel like there was a right or wrong answer to the question. A lot of the times it's for them to just understand, what is your thought process? Are you, if you are stuck, are you willing to admit that you're stuck and you want, where can you find more information to to get more guidance? They talk about, tell me about your communication style. Tell me a time that you felt that you took really great care of a patient. What would you do if you made a clinical error? And so a lot of the times, one other question that people have asked is like, what are 3 areas of improvement for you? Or like where do you think that you can improve on? And so a lot of the times these are where they're trying to understand, are you reflective? Do you take time to kind of think about where you can improve? Because all of us can improve on something. We all like make mistakes. We all can become better individuals. And so a lot of the times it's a good question. It's a hard question and it doesn't have a right answer, but it's a question that you can kind of think about as to like, what are the areas that I do want to improve on? And also kind of throw it back at them, and do you have the resources that I need for me to improve on those areas? Make it again, think about it as a two-way street. Like, yes, they want you to be reflective on like, how can you improve? And then for you to be also ask, do you have the resources that I may need in order to improve on these things? Personal goals. Where do you see yourself in 5 years? What are your long-term goals? And a lot of these personal goal questions is where you can kind of ask them about like, what is the midwifery culture like? What is, do the midwives practice with autonomy? Are midwives being hired as more of physician extenders? You can all, that is a great way for, again, both, for it's a dialogue 2 ways, like for them to ask you like, what is your goal for providing midwifery care, and also like what are the things that are set up for you to be able to provide the care that you desire. And then more clinical questions. So philosophy of care, they'll ask you about your experience, and then some clinical scenarios. And so the piece when it comes to like clinical scenarios, think of the clinical scenarios as like this. I would urge individuals to always like think about one hard case that you've had, and maybe even a hard case that you've had that ended up having where either they had to do a review, where it's like either someone had really heavy bleeding or a shoulder dystocia or something of that nature. And a lot of practices, when there's a difficult case, they will at the end have like a review of like, what could we have done better? What could we improve on? And so for a lot of the like clinical scenarios, for yourself, just to think about like a really great case and think about a case that was a little bit more difficult, that probably either if it didn't have a clinical review with the team, then at least a clinical review that you've had with a preceptor, where you again have like discuss like what could you improve on and how it might have, and if it changed your practice, why did it change your practice? And so those are, again, a couple of clinical scenarios. I would say, you never know which way the clinical scenarios would go. A lot of the times they're not testing you as to like that you have the right answer. It's just like, okay, what did you learn from that experience, and how has it changed your practice if it has, and what are the things that you hope um, that you think that you need in order to be able to provide really great care. And so on here are a couple of resources. One of them is the UC San Francisco Office of Career and Professional Development. On there are people are able to sign up to have your resume reviewed. You can sign up for mock interviews. And those are two really, really, really great resources. The Cal State Fullerton also has their own division. It's called the Division of Student Affairs and Career Services. And even just on the screenshot, they had workshops on how to update your resume. They had also availability for you to sign up for mock interviews as well. So there are resources within each school. Almost most schools do have a career services program where they will like either go over reviews. They might even have like certain companies that like every time they have like an opening, they ask like, hey, can you post for we have a job opening. We've hired a lot of your students in the past, so we're eager to hire more. And so that would be, like I said, those two, going through the school to get help in that regard. The Grow Midwives website, they have really great articles within their website on how to negotiate, how to ask for how to build a clinical practice, how to make adjustments as to asking for like a raise or things of that nature. They also do they also offer services that you can buy for consultations, but even if you do not pay for a consultation, their website is full of really great resources. They even have another list of like interview questions that people have commonly been asked. So the Grow Midwives website is a really great resource. And another resource that is very similar is called the Midwifery Business Consultation website. Again, they have a lot of blogs and a lot of articles on how to interview, how to negotiate a job offer. So that would be like the next step after the interview process. But it can be something it can be really stressful for individuals once you do get an offer of like, is this an adequate offer for the area that I'm going to? For many individuals, this is the very first time you're negotiating a contract. So sometimes it is really helpful to have some guidance as to like how to, what are the, one big tidbit that both of them had said is never tell anyone a number. Like, do not give someone a number before they give you a number, just because what ends up happening is that you might undersell yourself without even realizing. And I've learned that myself. I did that for my very first job and I regretted it. And so that will be the one tip I will pass on to you guys. Do not give a number, and just like, you know what, I want to learn more about the job market and I will get back to you. Like, what is your budget? And then we'll kind of go from there. But that was one thing that I didn't learn about. I thought I knew what the number was, but I did not. I undersold myself short. Yeah. And so that is the big meat of my presentation. I wanted to ask if anyone had any questions.